Well, hello everyone. Welcome. We're very glad that you are here joining us for this early childhood workshop. Tonight we're focusing on quality first recommendations for safe childcare operations during COVID-19. And we're so pleased to be able to partner with quite a few organizations who I'll introduce in just a moment. The next slide. My name is Dr. Eric Boucher. I'm the Executive Director of the Arizona Association for the Education of Young Children, which is one of two state affiliates of the National Association for the Education of Young Children, AzAEYC. Stay connected with us on Facebook and Twitter. We often share information about professional development like this. We also share upcoming advocacy opportunities to make your voice heard on behalf of yourself as a professional or on behalf of children and families. And then we also provide additional information on accreditation and other quality improvement resources. So here's my email and our social media, so please connect with us in whatever way you see fit. And next slide. So this event is not done alone. This is really a collaborative opportunity that took place between several agencies, really coming together to say that we knew that there was a need in the field for continued and additional information regarding quality improvement and health and safety practices in quality programs. So I just want to take a moment to thank our partners who collaborated on this session. AzAEYC is the organization that I work with. Barbie, would you like to introduce yourself?
Hi, I'm Barbie Princer with the Arizona Early Childhood Education Association. I am so thankful for First Things First doing this with us tonight. This is going to be a great collaboration.
Great, thank you. Michelle?
Good evening, I'm Michelle St. Hilaire. I'm the Senior Statewide Program Director of Childcare Resource and Referral, which is a statewide program of child and family resources. And, you know, to what Barbie said, we're super excited to be able to offer this opportunity and have our wonderful resources and panelists join us tonight.
And our good friend and colleague Kelly Ann Larkin is the Executive Director of the Southern Arizona Association for the Education of Young Children. She'll be joining us in this webinar shortly, but SAZEYC is our sister affiliate to AzAEYC. We're both NAYC affiliates here in the state. We're also really pleased to partner with our colleagues at First Things First and Quality First to provide the content for this session. So we'll turn it over to them in just a little bit. I do want to mention that this session is free to participants, but there is a cost. We pay for the platform as well as the time of the people participating in this event. So we just want to make you aware that this event was made possible by a grant from the Robert Wood Johnson Foundation in partnership with Childcare Aware and NAEYC. So thank you to them for funding these important opportunities. Our organizations that are listed here have been consistently providing childcare COVID-19 conversations where people can come together, hear from experts and from early childhood professionals about some of the things they've been doing in the community during this pandemic and try to learn and be with and support each other during this time. So we're glad to have this session as part of that longer series of opportunities. And next slide. So let's talk about what we're going to be doing throughout this session. We just did our welcome and introductions. I'll turn it over to our panel to introduce themselves in just a moment. We're going to spend most of the beginning of this session really diving into the Quality First guidance document. It's a document that provides some ideas and recommendations based on current research and health and safety expertise to guide childcare programs as they're making decisions about supporting young children and families during COVID-19. We'll talk about preparedness and response planning, and then what it might look like to put in place a plan for positive COVID-19 cases in a program. We're going to hear from the voices of Quality First childcare providers. We think it's particularly important for those who are doing the work directly with children and families to have their voices elevated and to share the challenges and successes that they've experienced related to health and safety practices and policies during COVID-19. So we'll hear from some early childhood professionals later in the session. And then there's an opportunity where you'll be able to ask specific questions. So as you hear information or you want some clarification or a question pops up in your mind, at the bottom of the session live, there's a Q&A box. So you can go ahead and type in your questions and we will answer them either throughout the presentation or at the end of our session. We have a time set aside just for that. Next slide. I also want to make sure we're very clear that our goal tonight is to provide a space where we can share as up-to-date research and health-based information as we can to help programs make decisions based on that information that will help support their local children, families, and their local community. So the information that we share tonight is aligned with and based on the information that we know now at the time of this presentation. It's aligned with effective practices regarding safe operations for childcare and early learning settings, but that the information is not intended as specific guidance or specific recommendations for a program to have to do. It's not mandated, but we do think it's important to get this information into the hands of early childhood providers so that they can analyze the information, see what fits and what works well for their program, and then make decisions based on their own children, families, their own policies, and their own contexts. So we think it's important to just note that these are some ideas that you can implement, but ultimately it's important for early learning providers to really make decisions based on their local context. So without further ado, I would love for our panelists to take a moment just to each share a little bit about themselves, who they are and what they do. We are so pleased to have early childhood health experts from across the state joining us in this session. So I'm going to turn it over to Emily to get us started off. Emily?
Hi, I'm Emily Rebro. I'm the Childcare Health Consultant Program Manager for Quality First at the Pima County Health Department. And for the last 5 months, I've also been serving as the Childcare Liaison for the Pima County Health Department.
Hi, my name is Laura Monarque. I'm a family nurse practitioner and I work as a child care health consultant for the University of Arizona Cooperative Extension. I work in Santa Cruz County, which is the smallest county in the state of Arizona, and it's situated adjacent to the US-Mexico border. Welcome.
Hi everyone, my name is Octavia Thompson. I am a child care health consultant with Navajo County Public Health. I specifically serve the Quality First sites on the Navajo Nation.
Hi, welcome. I'm Marnie Richardson and I'm a registered nurse and I work as a child care health consultant part-time in the field and as a lead nurse supervising in the office for Maricopa County Department of Public Health. And I've been a child care health consultant for 11 years.
Okay, thank you to our panel. Thank you for introducing yourselves, and let's give a warm welcome to our panelists. We're so glad to have your expertise and insight here with us tonight. Our childcare providers are joining us as well, so maybe they could just say their name real briefly, and then we'll get to hear from them later in the session. Jen, do you want to start us off?
Sure. My name is Jen Wolf. I am a preschool director in Maricopa County at North Phoenix Baptist Preschool, and this is my 22nd year in early childhood.
Thank you so much. Kira?
Hi, I'm Kira Klaus. I am the preschool director at Learning Works Preschool. We're located in Peoria, Arizona. We're a single site private preschool. We've been part of Quality First since its inception, and I have been the director for 3 years.
Thank you. And one last colleague is Sarah. She's joining us and helping monitor the chat box in this live session. So Sarah, would you like to introduce yourself?
Sure. Good evening, everyone. I'm Sarah Harrison. I am here on behalf of First Things First and Quality First. I oversee the Child Care Health Consultation Program for the state, and I'm really excited that you're all here joining us this evening. I think it's going to be, you'll get a lot of great information from today's webinar.
All right, thank you so much. Let's turn it over to our next speaker. Tell us a little bit about an overview of this guidance document that you're providing tonight.
Hi, there was one more person, Karen Hoffman, is also on
Karen,
the panel
please.
today.
Thank you, Emily.
She
Oh
can
my
say
goodness.
a few words.
Yes, thank you.
Can you introduce yourself, Karen?
Yes, I'm Karen Hoffman. I'm a registered nurse. I'm a supervisor for the Child Care Health Consultant Program over at Maricopa County. I'm here to support everybody tonight, and I'm going to assist Sarah in answering questions.
Great, thank you, Karen. All right, and thank you all for attending this webinar today as the Quality First program releases its health and safety guidance document for childcare programs during COVID-19. We hope it's useful for you. I'd like to tell you a little bit about why it was developed, what sources of information we use to develop the document, and how you might use it at your site. So next slide, please. So why did we want a comprehensive list of health and safety guidance? You know, if you think back to March, if you can, everyone was searching for guidance and little was found. Then month after month, more guidance came out and we were grateful for every piece. After a while though, it just became too much. You went to one page, clicked a link to another, and on until you forgot what you were looking for, or you couldn't find the page you thought it was on. Then there were the recommendations from colleagues, your friends, listservs, Facebook, Twitter. Everyone had something to say and not everyone agreed. There was just too much information in too many places from too many sources. It's a full-time job just to keep track of what's changed, what's new, what you should do to stay healthy and safe. I know, as child care liaison for the emergency response team in Pima County, that was my job for the last 5 months, and even I got lost going down that rabbit hole of the information highway. Thus, the idea for one comprehensive guidance document was born, a one-stop shop for health and safety in childcare during COVID-19. So next slide, please. So sources of information. So remember all of the links that you clicked on to find answers, masks or not masks, how much bleach do I use, how in the world do you socially distance in childcare? We went to those same sites, the CDC, Arizona Department of Health Services, American Academy of Pediatrics, even other states' health departments' childcare guidance pages, and reviewed them all. Our focus was to make sure the guidance was from reliable sources and was comprehensive. Everything in the guidance document corresponds with guidance from the CDC, which is the main source of reliable, vetted information. Once we had a draft, the document was reviewed by other CCHCs around the state Early Childhood Education System partners, and by the Arizona Department of Health Services to ensure that there were no conflicts with licensing in our state. So next slide, please. So how can you use this document? We decided to create the document as a checklist. Our hope is that this format makes the information easy to find and read in comparison to paragraph after paragraph of information. This is the table of contents and a sample of what it looks like. Sections such as sanitation are concrete. Are you currently following these recommended practices, such as using an EPA registered disinfectant that works against COVID-19? Check. Could you add any of the recommendations? Each suggestion you add may reduce the risk of spreading COVID-19. Next slide, please. So think about the checklist as a continuum. When COVID-19 is widespread in your community, are there procedures you might add until the numbers go down? Masks, individual supplies, or spaces? If there is little or no spread, are there things you might change? Increase group size, ask about temperatures instead of taking them, etc. There is nothing outside of licensing that you absolutely have to do. Decide what works for your program. Every site is going to be different. And what you do one month may be completely different than what you're doing the next month. We are all making the best decisions that we can at the time with the information that we have. The checklist can also help you make plans for these different circumstances. Have you thought of everything you might need to do if someone tests positive at your site? So next, Octavia and Laura are going to show you how you might use the planning section of the document to make sure you have comprehensive plans in place this pandemic. So next slide. And then Octavia, take it away.
Thanks, Emily. So as part of your emergency response plan for your center, program should also include a pandemic preparedness and response plan. We've all quickly learned that exclusion policies for sick children and staff and those who have sick family members have become stricter during the pandemic. We've seen changes with health screenings as they've become more stringent. Physical distancing and wearing face masks in childcare centers are common topics that we are all having in our discussions. All of these changes are why there is a need for a pandemic preparedness and response plan. Having this plan in place helps staff, families, and the community be aware and understand what their role is in the pandemic plan. As Emily mentioned, knowing the level of community spread is important as it will help guide your decisions about changes to the mitigation strategies that you currently have in place at your center. Within the guidance document, there are a few links to some resource documents that will help you monitor and track your community spread. One is the Arizona Department of Health Services data dashboard, which, as you probably know, includes state information on COVID-19 as well as local county information. There is also a link to the Johns Hopkins map, which you may find helpful, and if it pertains to you, we suggest looking into your tribal data dashboards as well. And your local county health department may also have a dashboard available to you. Next slide, please. I know it seems quite overwhelming when you think about writing a pandemic plan. What is great is that the CDC has done most of the work for you. You see here the first page of a 2-page checklist that the CDC has called the Childcare and Preschool Pandemic Influenza Planning Checklist that can be used to support your efforts in developing a COVID-19 plan. Much like the Quality First guidance document, this is also in the format of a checklist, and you can use it as a guide to work with your staff to develop your pandemic plan. It is important to note that a pandemic preparedness plan is a living document, so it should be reviewed, practiced, and adjusted often. You will find a link at the end of this presentation to this document. It is also included in the planning section of the Quality First guidance document. Next slide, please. Okay, so now we're going to shift gears and talk about one of the most common questions right now: what to do if someone tests positive for COVID-19 at their center. The checklist can assist you in creating a plan for positive cases. We recommend having a plan in place before there is a positive case. When you create your plan, here are a few important considerations to think about. So what is in your plan? To ask families and staff to report any cases of COVID-19 in their households, or of any recent exposure with someone who has tested positive. Laura will be sharing more later about what close contact means. What is in your plan to train staff on policies and procedures? Things here might include staying home when ill. How long will staff stay home? Letting you know if they or a member of their family has tested positive. What are the expectations around cleaning, social distancing, the use of masks, anything that may be different now? Communication and transparency with families and staff are appreciated by all at this time. The best way to have staff and families notify a site will vary from site to site. Programs normally already have in place some sort of communication system, such as electronic notifications or notes that go home to families. Having clear procedures and expectations documented for everyone will ensure that steps to reduce the spread of the virus can be taken as quickly and as efficiently as possible. Next slide, please. So when you create your plan for positive COVID-19 cases, you want to make sure you have a plan in place to monitor staff and children, their absences and illnesses. Keeping your illness logs up to date is very important right now, and also making sure that you have someone at your center who is checking it regularly to see if there has been an increase in illnesses or absences. You also want to make sure there's a process in place to notify the local health department and or local county jurisdiction of a staff or a child who's tested positive for COVID-19. You also want to have a process in place to notify families and staff while maintaining confidentiality of that person who has tested positive for COVID-19. The local health department can be a great resource to you. They can provide guidance on what steps you can take at your site. You will ultimately make the final decision as to what's best for your children, your families, and your staff at that time. The local health department may also have some resources for you to use, such as parent alert notices and letters you can use to notify parents of the positive case. Next slide, please. You should also have a plan in place on measures you can take at the site. Think about what you can do for the next 14 days after the child or staff has tested positive for those who remain on site. This includes a plan to expand and or reinforce mitigation strategies to prevent the spread of the virus, including enhanced daily cleaning measures. What will physical distancing look like during mealtime, nap times, activities? Will there be limited sharing of equipment and materials? Will the classrooms be reduced to a number of children? Will there be no contact or limited contact between groups of children and staff? And what are the expectations around the use of masks for children and staff? You should also think about deep cleaning measures. Will your current staff be able to handle the deep cleaning that is needed? If you decide to hire someone, who will that be? What is their contact information? Is there a licensed area that your children could move to temporarily if needed for the cleaning to take place? The CDC recommends 24 hours before cleaning if the person was just on site. In addition, you should think about whether you will recommend or require testing for your children and staff. If so, what are those circumstances? When it's recommended by the health department, will you leave it up to each individual and their healthcare provider? Do you know how to find those testing sites? Next, Laura is going to provide some more details around planning for COVID-19 cases.
Thank you. Good evening. If staff are tested, they may want to stay home until they get their results, or maybe be absent due to illness. It is important to have available a plan in place to cover the potential staff shortages and flexible leave policies and practices. These policies ensure that staff will not return to work while still sick. For possible staff exposure to COVID-19, because they are essential workers, they may continue to work provided that they do not have symptoms and that they wear a mask. But ultimately, this is entirely up to you and your decision. You should have a plan in place for classroom and program closure. Short term would be 2 to 5 days, and long term 14 days or more. Usually a single case of COVID-19 in a child care program would not warrant closing the entire facility. Community spread and the amount of contact the person with COVID-19 had with others, as well as when such contact took place, need to be considered. If a positive case is identified, child care programs should work with their local health agency to determine the next step for potential closures and mitigation measures. In the next few slides, we will review the guidance from the Arizona Department of Health Services on when a person can end isolation after testing positive for COVID-19, as well as the quarantine guidelines for close contact exposure to someone who tested positive. Next slide, please. Can I have the next slide, please? Thank you. On July 27th, the Arizona Department of Health Services provided this chart to help Arizonans determine when they should end isolation after having tested positive for COVID-19 and after having been evaluated by their healthcare provider. And as you can see in this chart, it's very easy to follow. The first question is, at the time of the testing evaluation, was the patient experiencing symptoms? So if the answer is yes, then you just follow the questions and you keep going down. It's very easy to follow and understandable. And if the answer is no, no symptoms are being experienced, then you go to no, and then you just keep going down the line until it tells you whether you should be isolated, no isolation required. So it's a very neat tool that is existing now. Next slide, please. In addition, Arizona Department of Health Services has provided guidance for close contacts. Close contact is considered when someone has been within 6 feet of an infected person for 15 minutes or more. Close contacts should be quarantined for 14 days after their last exposure with someone who tested positive for COVID-19. Next slide, please. While in quarantine, people should stay home from work, school, or childcare and remain 6 feet away from others. Those in quarantine should be self-monitoring for symptoms of COVID-19 and should avoid people who are at high risk for severe illness. Essential workers without symptoms can continue to work, should wear a face mask, and should monitor themselves for symptoms. There is still a lot to learn about this virus, and we will continue to update our guidance document as new information becomes available to ensure child care providers have access to the most current information. Thank you.
So I'm wondering, before we move into hearing from our childcare providers about some of the successes and challenges they've been facing with implementing many of these health and safety procedures, I wonder, Sarah, would it be helpful to pull up the document and walk participants through it, or just maybe show the title page, or give some additional kind of visual guidance?
Yeah, sure, I think we could do that.
All right, so I went ahead and put the link to this presentation, or to the recommendations guidance, in the chat box. If you're joining us at the self-paced webinar, it'll be included in the information in the registration page. But I'm gonna scroll down, and whoever would like to take us over, I can just tell me when you'd like me to scroll. I'm happy to do it.
Emily, are you going to speak to this? Or?
Sure. So the first part of the document, it just gives you an overview kind of COVID-19 as we know about it right now. The second part of it talks about the mitigating risks. So these are kind of the infection control strategies where you can go through the document and look and see, are these things that I'm doing, or are these things that I can add? Or if it's minimal spread, you know, maybe I can start looking to say, I might stop doing a few of these things. So that includes things such as your arrival and departure procedures, and all of these really follow a lot of the CDC guidance. It's just trying to put it in a really easy to read format, and a format that people can use more as a checklist rather than having to read, you know, paragraphs. Then, you know, and that also includes, you know, how you monitor for symptoms and screening protocols. There's also a sample daily health screening for COVID-19 on here, and that includes, what kind of questions you can ask during a screening process, and the signs and symptoms that you're looking for, as well as defining, what a close contact is. Then the next section, it's guidelines for returning to childcare and work. And these guidelines, do change over time. So we will be trying to update this document as changes take place. And the changes you can also usually find on the CDC or the Arizona Department of Health Services, or, a lot of your counties also have individual guidance. And those are often the questions that I get a lot, or, when do we know that someone can come back? And there really are a lot of very defined checklists for that are available, which is helpful. And then the next section is on planning your physical space. So before, even the children enter, what are things that you can do? Have you posted your signs? If you have a large group space, have you divided it so that children won't be mixing? You're really trying to keep children in their pods. Do you have waiting areas, or you have your 6 feet marked to help people stay 6 feet apart? So those type of things, and that's also even like looking at your ventilation systems. Are they operating properly? Can you increase circulation of the outdoor air? Do you have an isolation room? So there's a lot of different things to think about before the children even enter your facility. And then, you're also looking at health and safety equipment. That's the next section. And that's your cloth facial coverings. You definitely need to know your local recommendations. The CDC does recommend all adults are using them, and then as feasible for children. So this kind of gives you some information. And at the bottom of each of these sections, there are resources that give you more places to go. And that's where you can, go back down that rabbit hole if you would like, of all of the information. Then if you keep on going, it talks about gloves. I will say one note about gloves is you really don't need to wear them any more than you normally would have for things like diapering. Your skin itself is a glove. And the hand washing is really the important part here. And that kind of gets to your sanitation and hygiene practices section. There have been a lot of questions about, how to clean and sanitize. Is there something different about it? So here's kind of a checklist you can go through and see if these are the things that you're doing. There's a list to, a cleaning schedule. You can compare that to the cleaning schedule you're doing. Places to look to see if the disinfectant you're using is on the list of what the CDC recommends. And it also talks about cleaning your outdoor areas. That's been a very big question because some of the CDC guidance will say, just clean it normally, and there's certain things you should and shouldn't clean. So this is just a very brief overview of what the guidance says. And then hand washing. As you can see, hand washing is a very big thing. It has a large section in and of itself. That 20-second scrub is very important. And thinking about all of the times, we always recommend that you actually look at your schedule and try to plan hand washing in. But here is an easy way to do that. You can just say, am I doing it at these times or not, and check them off. And this is one of the things we would recommend you do at all times, no matter what, whether COVID is widespread or not. Also thinking about just those protocols for coughs, sneezes, runny noses, if you're allowing that into your center. And then toothbrushing too has been a big thing, because right now they're recommending you temporarily discontinue that. So encouraging families to brush at home is even more important. And then the next section is on physical. We prefer calling it physical distancing, but most people know it as social distancing. And those are, the biggest questions are how you keep the children apart. So here are just some very concrete ways of thinking about starting from your waiting area in the front with the signage and marking the areas, to the idea, you know, part of physical distancing is just limiting visitors, so there aren't as many people in the building to be the distance from. Then also just thinking about your daily operations, your ratios. Obviously, it's going to be easier to maintain distancing if you have fewer children in a room and you have more staff who can kind of monitor where they are. Then thinking about, you know, limiting mixing of groups and children. So that's kind of the idea of the bubbles or the pods, whatever you like to call them, where you try to keep one group separate from the other group throughout the day. And that kind of helps if there is a positive case at your site, that it's limited to that pod that they had that close contact with. So even if you haven't been perfect with physical distancing, you can limit physical distancing, at least of the groups. Also looking at meal times and snacks. So, you know, are children spaced out for 6 feet or as much as you possibly can? You know, if you can stagger, you know, the times that they're eating, that might also help. Thinking about your family style meals, you know, in Quality First, we always really recommend family style meals. This is the one time we're going to tell you, you know, you really need to not have them sharing those utensils and plating it. So is that something you're already doing? You can kind of check that off. Thinking about nap time, again, that's where, you know, you're really thinking about, do you have that 6 feet of distance? And if you can't get too far apart, maybe you can place them head to toe. So in addition to that physical distancing, you really want to limit the sharing of equipment and materials. And that's another way that you're keeping people apart. It's not only their bodies, but also the materials that they're sharing. So, you know, thinking about, do you have a policy of personal items that comes in from home? And do you want to change that? Thinking about art materials, can they have individual crayons and Play-Doh? Or do you even want to use Play-Doh at this point in time? So there's kind of a way to look through it and see if you're already doing it, or if you can add these different ways to limit the sharing of equipment. You know, and then other sections are on transportation for those centers who have transportation to think about. Thinking about the infant and toddler care, you see this on the CDC site. The diapering video, I just heard Marnie say, is hopefully coming out on Friday. And we're all excited by that. So there should be an online training from Maricopa County, who does an amazing job on their online trainings. So we will message out that definitely that you'll be able to take it and see kind of the best practice way for diapering. You know, and then when you're washing, feeding, holding children, do you have those extra smocks and things that people can be wearing? And then and enough that they can change them throughout the day. And do children have extra changes of clothes for the same reason? And then really thinking about your vulnerable and high-risk populations too. You know, seeing, you know, should people check with their healthcare providers? Can you take more precautions? Are there certain staff that can telecommute? Can some staff have more protective, personal protective equipment? Be in positions where they're keeping more physically distant. So thinking about those people, as well as the children who have special healthcare needs, this is the time to really check your care plans and make sure that they're up to date. And if there's anything extra, or even should the student or this child be in a facility at this time, you know, is that recommended by a medical profession? And then also thinking about if your site has been closed, you do have to, there's some extra considerations you have to think about. One of the biggest things is Legionnaire's disease. And that's, you know, if you haven't been using the plumbing for a while, it can grow. And then when you flush a toilet or open the sink, it'll aerosolize and infect people. That's actually happened at a site, a government site a few weeks ago, who hadn't been using it. I have it here. So then the next section, and then that's the water, water ventilation. So the next section going down is the planning, the preparedness and response plan. Eric, you're doing great there, scrolling through that. And that is what Octavia and Lara were talking about and went through. And that's kind of one of the bigger questions, I think, for people right now. And then the last sections are really about communication, because I think throughout this entire pandemic, the biggest thing has been communication with your staff, communication with your families, and just that general understanding that things are going to keep changing, and that open line of communication and transparency is just vitally important right now. So have those plans in place on how you're going to communicate with them for all different types of situations. Not only if there's a positive case, but maybe even for good things that are happening, just like you would in regular non-pandemic times. And that's kind of, and then there's at the end, there's just the additional resources. And the last thing I would say about this document is that it is definitely a living and breathing document. We are hoping to update it as much as possible. And if you think there are things that we haven't included, please let us know. And we were happy to keep changing it and move it. So that is our document that we are introducing today.
Thank you so much, Emily. I appreciate you taking the time to walk us through that. I think what I'm most appreciative of the First Things First Quality First team and the Childcare Health Consultation team was really there's so much important information from a variety of reputable sources, the CDC, the American Pediatrics Association, lots of other just resources all in many places, and putting it all into one document in an easy way that programs can really look through and see what they are doing well and successfully, and then making some decisions about, I as a provider, I'm not doing this piece, maybe that's something I need to be considering. I think that sort of everything in one place and having it as a checklist could be particularly helpful for providers. So I just wanted to take a moment to thank you all for walking through that and putting that together. That took a lot of research and collaboration. So I appreciate it as an early learning professional myself. So thank you. So I'm thinking now might be a great time to turn it over to our childcare colleagues who are joining us tonight, who can share a little bit about what they've been doing in terms of health and safety. And so we'd love to hear each of you. We've got a little bit of time, so feel free to take some time to just tell us a little bit about your program if you'd prefer, what you've seen in terms of a difference now that you're operating during COVID-19, any successes or challenges. So we've got maybe about 6 minutes each, and then we'll have a chance to open up for questions and answers. So as you're listening to providers share their experience, please feel free to type your questions there at the Q&A box if you're in the live session. And I'll turn it over. I think Jen is starting us off.
All right, thank you, Eric. My name is Jen Wolf, and again, I'm from North Phoenix Baptist Preschool. And first of all, I just want to say what a great document this is. I've been looking over it the last few days, just preparing for tonight, and it really did help me kind of look back and focus on the things that we've been doing over the last few months. And so it was a nice little checklist to say, okay, we've got this, maybe we need to document what we're doing. So I would encourage all of you providers to use this document, and it's nice that we can use it to really create a plan that is best for our center. So that's what I love most about it, is that we can take the good things that really fit into our school and make it useful for each of our centers, because I know we're all so different. I also love that it's from Arizona. So for those of us who are using things all over the country, this document is great because it's specific to Arizona. But tonight, I just want to speak a little bit about positive cases. As a provider, it definitely is a scary thing to think about having a positive case in your school. If you haven't had one, it's something that I just want to talk through tonight. And a little background on us, we typically have around 120, 130 families here at our preschool. We, when COVID hit, we did close for a few weeks, and when we came back, we had about 70 families. And this week is our first week of our new school year, and we're back up to about 120. So it's going well so far, but it's always good to stay on top of these policies. We started in May 11th, we reopened. and things were going great. Our policies were in place. We were communicating with parents. Everybody was feeling good. And then in July, we did have a positive case. So it was a little scary. I know when we found out about that, again, it was a scary thing to think, okay, now we have a positive case. What do we do? But we were able to go back to those policies and start communicating. And that really is the most important thing with having a positive case. I feel like you can have all the policies in place, but the communication was the scariest piece. And I say it's scary because as a provider, you know that you need to communicate to your families, but you also know that they're scared. And so you're trying to find the best way to communicate with them. But I would just suggest to communicate quickly, communicate often, and be available for your families because it is scary. And we want to continue to build that trust. And the more we communicate, the more trust that we build with our families. And although we need to keep that confidentiality, we still need to communicate well. It's important to communicate with your staff as well as your families. And I would say staff first. What I chose to do is, again, send to my staff what I was going to send out to families beforehand. So they knew, and if families contacted them, they knew what information we put out, and we just really focused on that confidentiality as well. But be strong, be honest, be open, and communicate well. That's really what I'd like to suggest to all providers. And don't be scared. It's a scary situation, but don't be scared because you just have to work through this together. I think that's all I have to share tonight on that piece, on positive cases.
Thank you so much, Jen. We appreciate you taking the time to share a little bit about your experience and as a provider, what you faced and some ways that you've sort of addressed that as a early childhood professional. So thank you. I think we're turning it over to our colleague, Kira, to take us off on some more insight into what's been going on in childcare programs.
Hi, everybody. Again, I'm Kira. I work right here in Maricopa County. I'm a director of a preschool. My situation was a little bit different than Jen's and what she shared. We service a lot of frontline workers and essential workers. We were not able to close at all. So we were not even closed one day. We have rode the wave of COVID. It started in the beginning when not much information was available. I'm afraid that I was calling my CCHC, Karen Hoffman, almost daily, trying to get updates. I was watching the news every night on the CDC website every day. We took it as approach as we were staying open, we were serving essential workers during the time that Arizona was closed. Our essential workers, we were upfront and honest with all of our staff and all of the families. So we asked them to be open and upfront and honest with us. The first thing that we put into place is definitely an isolation policy for anyone who was exposed or experiencing any symptoms that possibly fit into COVID. Our main focus was not spreading it. So we wanted to serve those families that were needing the care, but we also didn't want it to come into the centers. So we did do a big letter out to all of our families asking for if anyone was directly exposed or experiencing symptoms to self-isolate to make sure that they were not spreading it to others. We were very, very lucky, and through all of the high closure times, we did stay completely COVID-free. We didn't get any positive cases until I would say mid-June was when we had our first positive case. It actually went pretty beautifully. I'd knock on wood, it was the best I think that it could have been. They self-isolated as soon as they were exposed. They were out for 10 days, no experiencing any symptoms. They did choose to take a test. They did end up positive, but by the time they experienced symptoms and got a positive result, they were already out for 10 days. So the exposure into the center was minimal to zero. We then closed off that classroom. We did a very, very deep clean in that classroom. and made sure that it was safe and clean after those 24 hours of waiting on it and before we used the classroom again. We let all of our parents know, and we didn't receive any transmission to anyone else in the center, so it was quite lucky. The only COVID cases we had was our 2 sister teachers that were directly exposed by a family member. So, and all of the guidance on the documents that was provided today is spot on, and it's exactly what we have done and found great success with. We limited any visitors into the center. We stopped the traffic into the classrooms. We social distance in the room. Social distance is not easy with children. So keep in mind, we did a lot of social stories. We did a lot of working with our inclusion specialist and our smart support specialist about how to present it to the children, how to talk about it with the children. Alternates to hugs, alternates to bringing in toys to share with friends. The biggest problem that my kids experienced, and something that I will definitely mention that you guys should be on top of, is the emotional toll. We have a couple kiddos here that do have anxiety issues as young as 2, and it was very, very hard for them to see their teachers in masks, to see their teachers out for several weeks when they counted on them here every day. We were lucky enough to have our longtime subs fill in, so it was still someone that they know. But definitely do keep an eye out for that emotional toll that the children are experiencing with the masks, the distancing, and the loss of their teachers as they're out. That was the biggest thing that our children experienced, is understanding on all of that. And thank you for having me on, and I appreciate it.
Thank you so much, Kara. We appreciate your time. It was nice to hear about what's been successful for you, and for both of you, thanks for being open and vulnerable to share that there are some, I mean, this is a real disease, and it could be scary, and so trying to be as prepared as you can be and having those policies in place to minimize any spread and make sure that those staff and children and families are well taken care of and understand, you know, what's expected, I think is important. So thanks for taking the time to share your insight. Before we get into questions and answers, our colleagues on the panel, are there any other bits of information from that Quality First guidance document that we went through tonight that would be helpful for people to either maybe make a mental note of, or highlight, or just put a mark by, something maybe they might want to take back and test out tomorrow or next week, or as they're kind of thinking about their planning? Any just other feedback or tips or tricks before we open up for questions and answers? And I'll let anyone who wants to unmute and answer feel free.
This is Marnie Richardson, and I think the whole document is definitely worth taking the time to go through and see what you're doing and what you could improve on if you choose to do so. I think the area around personal belongings and like equipment sharing, I think is good. That's one area that we often don't think about. And I also think using the terms physical distancing rather than social distancing, so that we realize that we still need to socialize and talk to children, and it's really more about the space rather than the action of speaking. And that whole section on page 8 has a lot of good ideas, and it's a great document. I think it will be used. So.
Thank you, Marnie. Any other panelists have any other insight or feedback or tips and tricks for people to be thinking about as they're doing this planning?
There are some questions for the directors in the question and answer box. Should we read them off, or?
Yeah, we can get to that. I just wanted to make sure if anyone had
Okay.
any other insights they wanted to share, and then we can absolutely, yeah. it seems like, and part of I think one of our goals in this consistent series of workshops was to ensure that the voices of those doing the direct work was elevated and has a place to be able to, share their ideas, share their insight, share their expertise, and help hopefully support others who are experiencing many of the same challenges. So thank you again for our childcare providers for joining us. Any last insights or information about that Quality First guidance document from the panelists before we move into Q&A? All right, if not, no worries. I just wanted to check in. All right, so I think we've got a few questions there. Sarah, do you want to read off any of the questions for our childcare providers, and we'll see if we can answer those?
Sure. So we have our first question is for our two directors. So talking about physical distancing. So did the children keep physical distance while playing? And what did staff do to help keep children separate? And she's saying that she's going to be working with 2 and 3-year-olds.
I can answer that actually. In our centers, we actually, in our 2s and 3s room itself, what we did is we enlarged the centers. We also decreased the number able to play in each center at one time. One of the things that we have is we have a pre-COVID policy of how many kids can play in a center appropriately. We decreased that a little bit. We widened the centers. The children did actually not have a lot of trouble being a little bit more distant. The trouble was having enough toys to go around when you were physically distancing. When they're playing right next to each other with the same toy, pre-COVID, we had a lot of success with that. So we did purchase some additional toys that were the most popular toys that they would normally be able to play with in groups, just so we could have that together. Most of the kids were really, really good with it. We did have trouble with our 1-year-olds with this physical distancing. They needed that sitting on the lap. They needed that sitting close to each other. So what we often did is we provided that closeness, and once that closeness was provided, then we started moving back a little bit. And when they showed that need, we provided that closeness and then moved back. We were trying to get under those 15 minutes of that close contact that the CDC has been talking about. Most of the kids responded really well to that. And I hope that answers your question.
Thanks, Kara.
The same thing with the centers and just having really engaging activities. In each center, the kids naturally tend to separate themselves, and teachers are able to guide larger groups to other centers if there's more kids that gather in one center. So we did the same thing with just making those centers larger. So maybe taking out a table and making the area bigger so that they could have that separation. And so it's worked really well.
And I just wanted to add, as far as the infant toddler care, because you mentioned the 1-year-old care, that in the guidance document on page 15, there is a section on infant toddler care, and there's recommendations from CDC is that staff obviously need to hold children and feed children at times, and so wearing a smock to protect and cover your skin and being able to take that off and throw it away, or not throw it away, but throw it in the wash to be clean, and then making sure to wash your hands or your area of your skin that have been touched, and there's just if there's any secretions that get on you during that time.
Thanks, Marnie. So we have another question for our director. So how did you help children in your care cope with the emotional toll of all of the changes that are happening in their lives?
Since I touched on the emotional tolls earlier, I'll go ahead and answer. So the biggest thing we did was just start talking to them about it. We used a lot of social stories. I was lucky enough to have my inclusion and smart sport coaches send me some great sites. There are COVID social stories out there. You might have to search the internet for them, but the kids love to talk about it. They want to know what's going on. We did a lot of familiar faces for them. We tried to keep things as normal as possible. We didn't want to draw more attention to the COVID policies that we were putting into place. We wanted to touch on them and get them focused back on their routines, their day, work with them on that. We also worked very closely with the parents, talking about with the kids at home, assuring them when their teachers were out that their teachers will be back. I have one little kiddo where we even said, I spoke to your teacher today. She misses you so much and she wanted me to say hi and she can't wait to come back and see you. Just knowing that their teachers and their caregivers are coming back. They're not gone forever. Just talking about it in terms that the kids can understand. We just need to be very careful right now to stop the spread of germs, and we don't want to be sick, and I want you to feel good, and I know that you want me to be healthy, and just relating it in ways that they can understand, and just being there for them and that familiarity of their caregivers. They really need that.
And I would say the same thing with us. We used a lot of social stories when we came back to school. We actually, when we were closed, we sent social stories to the parents so that they could use those at home to kind of talk about why aren't we at school? Why aren't we seeing our friends? And so that was really helpful. And it really introduced our families to social stories. What are those? What are these things you guys are always using in the classroom? So we were able to partner with parents and teach them what those were about. And then when we came back to school, we were really nervous about that emotional toll of coming back. Would they be scared? They seemed to do really well. Our teachers really tried to communicate often with the parents while we were closed. And when we came back, we noticed that that made a huge difference because they were calling them, they were doing Zoom meetings with them. They would drop things off at their house and stand far away and wave at them. So there was a lot of different things that they did to continue to build those relationships while we were closed. And then when we came back, we did notice there were some things that happened. I remember a teacher was out one time. It was just a scheduled out. They weren't sick. And a child came in and said, does my teacher have COVID? And they were scared. They really thought, oh, they must be sick. And we realized at that point, we need to make sure the children know, no, Miss So-and-so is just with her family today. Everything's okay. And again, that kind of made us more aware that we need to make sure the children know when their teacher is out, why they are out, because they're thinking about that. The kids are thinking about it. So there's lots of things that we changed as we came back, but all good learning things that we had.
The only thing that I would add on that is just the social emotional, thinking about staff wearing masks and what that looks like to children. And there's a few tip sheets out there, which Kiara, I'm sure you could, Google or whatever, but we can share those as well if we need to. But just on how to smile with your eyes and how to talk about your emotions and how to make sure children know that behind the mask you're smiling, that you're happy, and communicating that. So again, going back to that communication piece and talking.
Yeah, that's a great point, Marnie. And actually, there's a lot of great links in the guidance document around face masks and the social emotional aspect of wearing them in the classrooms. So I have a question here for our childcare health consultants. So what is the best way to handle clothing in dramatic play areas? Marnie, what do you think?
That's a good question. So even before COVID, we needed to be careful about making sure that everything we have in dramatic play can be cleansed and sanitized or disinfected, be able to go through the laundry. So the guidance document does talk about kids using individual materials. So you want to try, if you can, to have each person have their own piece of clothing that they would wear, which obviously is going to be a little bit difficult. And I was trying to look in the guidance document to see what page that is on. I think page 14, where it talks about limited sharing of equipment and materials. Again, according to the CDC, you're definitely going to need to be able to cleanse and you know, launder the items after. And maybe have more materials, like Jen and Kira talked about, having more materials so that there's more options for kids in those areas as well. So I would probably recommend, when those, you know, first 3 kids are in that area, see kind of what they're using, and then maybe pull those out the next group of kids. It's not 100%. We're dealing with children, so we just need to do the best that we can do to stop the spread of germs. And that would be the couple of things I would recommend. If anyone else has anything to add.
Thanks, Marnie. Thank you. You covered it there. Thank you. So another question we have, and again, this might be a question for Kara and Jen. So Karen is wondering, what are centers doing about liability issues? So has that come up for either of you? And what kind of discussion are you having around that?
We have not currently had any liability issues. I don't have a lot of feedback, unfortunately, on the liability portion of it, but I think communicating well with your parents and seeing what their concerns are and having your policies out there and really following them is helpful, but I haven't really come across that yet. Kira, maybe you have.
Actually, no, I was about to say the same thing as you, is it hasn't come up. We have, right from the beginning, talked to our parents about what we were doing to put in place, what we were learning about COVID, what we were going to be asking of them. And we've had really good feedback from the parents, a great willingness on their part to do what needs to be done. We actually have not had anything really as far as liability issues that have come up yet. So I don't really have anything to share.
So this is a little out of my wheelhouse, but I do talk to childcare providers every single day, a lot of them, and I've run into a couple of providers that their board or their governing entity has chosen to have parents sign a waiver of liability. So you know, as a business, that may be something that you choose to do. But again, that's out of my nursing wheelhouse. But I wanted to share that piece.
Thank you. So this is kind of along the same lines type of question. So again, this is for our 2 directors. Did either of you experience any challenges with your families based on the new practices that have been implemented? And if so, how did you handle it?
I did have a few parents that pushed back. The practices that my parents pushed back on were the bringing in items from home, the walking the children to the classroom. We did stop having them walk the children back to the classroom. Those are the 2 main issues that I had pushback on. And all we did was reiterate why we were doing it, what we hope to accomplish with the practice, and that it was for the betterment of not only their child, but of all the children. We were doing it to try to protect their children, and we just focused more on that and how their children could benefit, and we kind of went from there. Those were the only practices I really had any issues with. Most of my parents were very, very willing to keep their child home or themselves home in the event that they were exposed. I didn't really have any pushback as far as that practice. Mostly it was the changes in routine that the parents had the pushback on. At least that was my experience.
I would say with our policies, again, parents were really willing to follow all the policies. They understood why we were doing it. It was really for the safety of their children, our staff, or really everyone. But there was some pushback because we are looking at symptoms. So when you have children who have congestion or runny nose, that was a really sticky subject, you know, and we had to send kids home, and then staying out for 72 hours, symptom free. We did have some parents, only a couple, that were just not happy about that. Most parents were very understanding and thankful that we were excluding kiddos who had those symptoms. But we did have a few that had a hard time with that, and I just tried to talk with them specifically and talk them through why we were doing that and why that was so important to follow. And to check for those symptoms and keep them out until they were symptom free.
Thanks. Yeah, again, I think the communication piece is so important that you all reiterated earlier is, you know, just communicating with your parents and staff up front, being transparent. That certainly helps to alleviate a lot of these potential challenging issues.
And just to piggyback off of Jen, some of that guidance has changed around exclusion. That 72 hours has now gone up to 10 days and 1 day fever-free with no medicine, and symptoms have improved. And you can look at that up on the document that you guys got attached from ADHS with this training to review that. And CDC is saying the same thing, and you need to check with your local health department, but Maricopa says the same thing as well.
Thanks, Marnie. So we have another question from Karina. So this is probably for our childcare health consultant panel. So what role, if any, does licensing and our regulatory agencies play when there's a case, when a case is positive and the program is not following guidelines to reduce exposure? And then the follow-up question is, what if a parent files a complaint about how a center is addressing a positive case? Is there any follow-up?
All right, that's a tough one. As far as ADHS, oh, the questions are moving and now I can't see it. Hold on. Sorry, Sarah.
No, you're okay with moving.
It moved and I don't see it now. So I think the first one was ADHS.
No, I can't find the question either. I don't know where it disappeared to.
Did it get answered? Maybe it got answered. Because it was a two-part question, it threw me.
So I think it's, you know, if regulatory agencies, what is their role in positive cases? If a program has a positive case and the center is not following CDC guidance, what happens?
So this goes back to when Emily first spoke, that this is a guidance. So regulatory ADHS guidance, that's the guidance that you have to follow. This guidance is actually recommendations. So as of right now, as far as I know, this is not a reportable disease to ADHS. You would report it to your local health department. And again, you could reach out to your CCHC if you have one and discuss how to report that. So as far as them regulating you following this guidance document, that would not be their role. Their role is just their regulations. Is that how you understand it, Sarah?
Yes.
Okay. And then part two, because I still can't find it. Was that the whole question?
Part two was if a family files a complaint against a positive case because because the program wasn't following any CDC guidance, what happens in that process?
A good question. Thanks, Eric. So I would reach out to your surveyor to make sure, but my understanding, again, is that you just have to follow what basic licensing is, and that you would not be responsible for these items in the guidance related to the CDC and American Academy of Pediatrics and ADHS these are guidance, but they are not mandated. Anybody else have something to add?
Marty, that's absolutely correct. Yeah, I think that's why this session was so timely and so important, I think, for childcare providers, because it provides all of those resources in one place to make local decisions about what a program wants to do in terms of serving children and families. There is no state there's no state mandates around what childcare providers are expected to do in response to COVID-19. So programs really have to take the information from resources like this Quality First Guidance document to make local decisions. And then of course they should stay up to date on any local mandates, like if there's a masking mandate for the public or if there's a masking mandate for private programs. I mean, it depends on the local situation, but at this point, it really is left up to programs to make those decisions, which is why we thought it was important to make sure these recommendations were all put into one place where providers could look at that, find that health-based information, then make data-driven decisions based on this research and this information.
Right.
So we have about 2 or 3 more minutes before we need to wrap up. So are there any other questions we want to highlight from our Q&A chat box there?
Sure. So I think this is probably a pretty common one that comes up. So infants, well, children in general, right, can display many different, some of the same type of COVID symptoms. So runny nose, irritability, things like that. How would a program decide if an infant or child needs to be isolated and sent home or just monitored?
Good question. So as far as I understand it, any symptom of COVID should be sent home unless a child has previously been diagnosed with asthma or allergies. So the symptoms that you're describing are symptoms of COVID. Unfortunately, we cannot take a wait and see approach, right? Because that means that kid is in our center and could be spreading it. So in these times during our community spread being so high, thank goodness cases are going down, but it's still very high enough to be community spread. We need to make tough decisions. And if they have symptoms that are COVID related, they do need to go home. And I'm seeing in there, can the panelists please repeat what you said about 72 hours and 10 days? So that goes right along with this. So in your guidance document on page 7 and also on your ADHS release and isolation quarantine guidance, which you have gotten in your forms before the presentation, it does say that if a person is symptomatic and has not been tested, so that means you do a symptom check and the child has a symptom but has not been tested, they need to stay home at least 10 days have passed since the symptoms first appeared, at least 24 hours have passed since the fever without the use of medication that reduces fevers, and other symptoms have improved.
Thank you, Marnie. Do we have time for one more question, Eric?
One more, yeah.
Okay, I think this is a pretty important one. So again, I think this goes to both of our directors. Are your programs requiring masks for children, staff?
Yes, we require masks for all of our staff and anyone that comes into our building over the age of 6 and older. For those children who are between 2 and 6, they are encouraged to wear masks, but they are not required to. And some of our kiddos do like to wear masks. I had a really cute story of a 2-year-old that came in one day. She had her dinosaur mask on and she said she wanted to be like Miss Katie. So she wanted to be like her teacher. So, and she came in and she wore her mask. So, so they're encouraged to, but those children between 2 and 6 do not have to wear them here.
Our policy is the same as Jen's. Anyone that walks in the center that is over 6 has to wear a mask. That is the Maricopa County guideline. So we do follow that. We are open and offer and encourage masks to 2 to 5. We try to make it fun for them. We definitely encourage it a lot. We've got a lot of kids that like it and a lot of kids that don't. So it's just a daily thing and we talk about it a lot with them. Open discussions are really, really helpful with the kids. Most of them are pretty open to it. So we've had some good success with it.
All right, thank you so much. Let's give another warm a round of applause, and thank you for our panelists and childcare providers for sharing their insight and expertise around safe operations during COVID-19. So we want to share a couple of resources. Before I do that, though, there is one question about a regulatory question. How does excluding parents from classrooms factor into licensing, as licensing regulates that families should have access to the space in which their children are cared for? The important thing to note is that licensing regulations are still licensing regulations. Those are actually statutes that are made by legislators, so those haven't changed. So a program should continue to follow their regulatory guidance from whatever regulatory agency regulates them, and then if they're an accredited program or are meeting a particular level of standards, they would be expected to still try to follow those standards and then make policies and procedures to align with those and then support safety and health as well. So the program really would need to make some determinations about what those policies look like in alignment with the regulatory statutes. All of the resources that...
Eric, I just wanted to say that, licensing does require them to, to be able to have access to their children, and you need to follow that, like you said. But in the same breath, if you want a parent to come on, you can have them wear a mask. I know we're doing the arrival health checks outside. Most parents are okay with that, but they do have to have access to their child if they need access according to licensing. So I just wanted to add that you can have them wear a mask or request them to, if that's your policy.
All right, thank you. We did talk through quite a few resources throughout this presentation. I do want you to be aware that all of the resources we've shared, as well as the Quality First guidance document and some other information that were sort of curated by our health experts here, are available at azaeyc.org/quality-first. All of the resources we've described in this particular session will be available there, so please head there to access and click on those links. You can also access the Quality First document at the Quality First website, as well as on the azeearlychildhood.org website. So it's out there. Childcare health consultants also were a part of making this document, so they have access to it and are sharing it with the programs that they work with. So hopefully you'll see it around in the community. Next slide, please. So whether you're participating live or in the self-paced webinar, in order to receive credit, in order to be marked as attended in the Early Childhood Workforce Registry, you do need to complete this survey, and we will mark you within 10 business days. So all you'll need to do is go to bit.ly/0813 Quality First QF, bit.ly/0813 QF. Take just a few moments. It should only take you about 2 to 5 minutes to complete the survey. Give us a little bit of information about your experience and any workshops you might be interested in. And this information will help us inform the next childcare conversations that we provide in the community. You must complete the survey to be marked as attended, or if you'd prefer a certificate of professional development, you will send me an email at ebucher@azaeyc.org. Make sure you've completed the survey, and I'd be happy to send you the link. It's been a pleasure having you join us on this session this evening. We appreciate your time and your participation. I wanted to say thank you again to our panelists of childcare health consultants and our colleagues from First Things First Quality First for helping provide this resource document for early learning providers and for making sure that we have access to information that we need to make informed decisions. We wish you well and take care. Thanks for joining us.